In this lecture, we're going to look at the superficial structures and cutaneous innervation of the upper limb. So we're going to look at the fascia of the upper limb, this connective tissue layer. We'll look at the superficial and deep fascia. We'll then look specifically at an example. We'll look at the brachial fascia. We'll then look at the venous drainage. We'll look at the cephalic vein, the basilic vein, and how they run into the auxiliary vein, and we'll also look at a communication between the two known as the median cubital vein. We'll then look at the cutaneous innervation of the upper limb, we'll look at the dermatomal distribution, and then we'll move on to some specific cutaneous nerves. So here we can see we've got both an anterior and a posterior view of the upper limb. And we can see that covering all of these muscles, which we're going to detail, is a white glistening layer. And this is the deep fascia. We have deep fascia, and we call it deep fascia because we also have superficial fascia. And the superficial fascia, which we can't see on these pictures because that lies deep to the skin and the skin has been removed. The deep fascia is what we can see surrounding the muscles, and the superficial fascia is this loose connective tissue and fatty layer. So we can't see that because it's been removed, but it's made up of loose connective tissue and varying amounts of fat. The superficial fascia lies deep to the skin, and it's therefore pierced by cutaneous nerves that supply the skin and also superficial veins. Lying between the superficial fascia and the skeletal muscles, so biceps brachii for example, we have the deep fascia. And the deep fascia we can see on both this anterior and this posterior view is this white glistening layer, this white glistening membrane, and we can see that it's covering all of the muscles we can see in the upper limb. It's made up of dense, well-organized connective tissue, and there's no fat. So this is just a membranous layer that surrounds the muscles. We're going to look at an example of the fascia, bearing in mind we have the deep fascia lying over all of the musculature of the upper limb. Specifically, we're going to look at what's known as the brachial fascia. We can see it here anteriorly. It's covering the arm. We can see it here anteriorly, and we can see it here posteriorly. So this brachial fascia encloses the musculature of the arm. So this tight cuff that is surrounding the musculature within the arm. It is continuous with superior structures of the upper limb. So it's continuous superiorly with fascia covering the deltoid, fascia covering the pectoral muscles, and fascia lining the axilla. So this deep fascia is continuous across the entire upper limb. And we're just looking at the brachial fascia here anteriorly, and we can see it here posteriorly. Again, a continuous layer with the deltoid fascia, the auxiliary fascia, and we can see here anteriorly the pectoral fascia. Inferiorly, the deep fascia is going to be continuous with what's known as the antebrachial fascia. Now, antebrachial indicates the fascia surrounding the forearm. So here we have the anterior aspect of the forearm, and we have the antebrachial fascia covering it. And we can see we've got this continuous layer. It's also the brachial fascia attaching to the epicondyles of the humerus, and this helps to anchor it down in position. And we'll talk about that later on when we mention the bicipital aponeurosis. So here we can see this deep fascia running all the way along the upper limb. Some important features of it: it also extends between the muscles. So as well as just covering the muscles of the upper limb, it also extends deep into the arm, and it attaches to the humerus. And as we'll see later on when we look at the arm in more detail, there are in fact two compartments in the arm. And these compartments are created by the deep fascia passing down and attaching to the humerus. They form what are known as medial and lateral intermuscular septa. So here we can see deep fascia, And here we can just see this medial intermuscular septum. And this septum here is actually going to pass deep into the arm and attach to the humerus. We also have a lateral one that's going to be on this lateral side. Here we can see it, this lateral intermuscular septum. So here we can see we've got these two septa that are passing deep, attaching to the humerus. Everything, therefore, that's anterior to it is going to be in the anterior compartment, and everything posterior to it is going to be in the posterior compartment. And here we have the two compartments of the arm. A similar arrangement occurs in most regions of both the upper limb and the lower limb. So, for example, in the forearm, we also have an anterior and a posterior compartment. And when we go and look in the leg region, we'll see that we have an anterior, a posterior, and a lateral compartment that are similarly formed via these pieces of fascia passing deep into the limb. Other notable fasciae that I've mentioned, I said the pectoral fascia that's running over the pectoralis muscles. We've got the deltoid fascia, we've got the auxiliary fascia, and we've got the brachial fascia extending down deep into the antebrachial fascia. And these are really important. We'll come back to them throughout the course when we talk about various muscles. If we now move on to some venous drainage, then there are two important blood vessels that return venous blood to the heart from the upper limb. These are known as the cephalic and the basilic veins. And we can see these just briefly here on this anterior view of a right upper limb. We can see we've got the cephalic vein here and we've got the basilic vein. This diagram on the opposite side, so this picture here, is indicating more deep veins, and we'll just cover those briefly. So, two important veins are taking venous blood from the upper limb back to the heart, the cephalic and the basilic. Both of these veins originate from the venous network, which is located on the dorsum of the hand. So this is the palmar surface of the hand. On the dorsum, which is the posterior surface, we have what's known as a venous network. And this venous network gives rise to the cephalic and to the basilic veins. We can see them here, cephalic vein, and we can see a basilic vein running up. This will pass all the way up to form the auxiliary vein, and here we can see the cephalic vein, which will run all the way up and pass into the auxiliary vein. These ascend up the upper limb within the subcutaneous tissue. So they run superficial to the deep fascia. They run superficial to the deep fascia. And both of these join up with the auxiliary vein. We can see on this side of the slide, this picture, the deep veins. I'm not going to talk about these much because we can cover them throughout the course when we look at the musculature. But the deep veins are located deep to the fascia, deep to the deep fascia. So they're running within the muscular compartments, and they run alongside the arteries of the upper limb. So, for example, an artery of the upper limb is the brachial artery. So we have brachial veins, and radial and an ulnar artery. So we have radial and ulnar veins. And typically these veins run as pairs or threes, and they're very small little channels that are running alongside the arteries. And because these veins have valves in, they use the contractile properties of the arteries to propel the blood through the venous system, but due to the presence of valves, the blood can only pass in one direction, which is back to the heart. Due to these valves, it can't pass distally. It only passes proximally as it heads towards the heart. So just look at the deep veins quite briefly. Here we can see, if we turn to the superficial veins again, we've got the cephalic vein and we've got the basilic vein. So on this diagram here, we can see the hand in this extreme over here, we can see the forearm in the middle, and then we can see the arm in this opposite extreme on the screen. And what we can see in the hand region is this dorsal network. We can see we have this more lateral dorsal network here, and we have a more medial dorsal network here. But these are all receiving veins coming from the digits. The cephalic vein is formed from this lateral dorsal network. And it's going to run up the lateral aspect of the forearm. It ascends the anterolateral aspect of the forearm. So here we can see a forearm, the anterior surface, and here's the posterior surface. So here we've got the lateral aspect. We can see the cephalic vein running up in this direction, and then it's going to run up into the arm. And we can pick it up again here. This is the forearm here. This is the arm. So we can see the cephalic vein is running up, and then it runs up along this side of the arm. You can see it's running in and it's piercing this deltoid fascia. So as I said, these veins are running superficial to the deep fascia, but ultimately they have to pierce the deep fascia to then pass into and form the auxiliary vein. If we now turn to the basilic vein, this emerges from the medial dorsal network. So we can see it here coming from this medial dorsal network. And here we've got the basilic vein. This is going to ascend the medial forearm and then enter into the medial aspect of the arm. So here we can see it just running up here. We can see it coming from the medial aspect of the basilic vein and then running up, pick it up again here. We see the basilic vein running all the way up, and then it's passing all the way up into the arm. Here again, we can see it pierces the brachial fascia. We can see it's piercing the brachial fascia now, and it actually unites with the deep brachial vein to form the auxiliary vein. So it pierces the brachial fascia and merges with the deep brachial vein to form the auxiliary vein. So the brachial vein is run alongside the brachial artery coming from deep. It receives the basilic vein, and these two veins uniting form the auxiliary vein. The auxiliary vein then runs up in the axilla, where it receives the cephalic vein, and then it becomes the subclavian, which passes back to the heart. So we can see we've got this superficial cutaneous venous drainage, primarily from the cephalic vein and from the basilic vein. At the elbow joint, there is a very important communication between the cephalic vein and the basilic vein. And this little communication here, it lies directly anterior to the elbow joint, and it's known as the median cubital vein. This runs across, joining the cephalic and the basilic veins. And this is an important location for venipuncture if blood is to be removed from the venous system. A communication anterior to the elbow that connects the cephalic vein to the basilic vein. A very important communication. So now let's move on to cutaneous innervation. Now you're all aware that the surface of the skin, the entire surface of the skin throughout the entire body, has cutaneous nerve supply. That is, there are nerves that innervate the surface of the skin so that when we touch ourselves, when somebody else touches us, we know that is happening. We are consciously aware of it. And we have these sensory somatic fibers which are returning this sensory information, be it touch, pain, temperature, or pressure, back to the central nervous system. But there isn't just, say, one nerve that does it, an upper limb nerve. We have a whole series of what are known as dermatomes, specific regions of the body that receive a specific spinal cord segment's spinal nerve. So remember, the spinal cord is divided into those various segments. We can have C1, C2, C3, C4, etc. spinal cord segments. Each one of those segments is going to give rise to two spinal nerves. Remember, this happens bilaterally on the left and the right side. And running within those spinal nerves are going to be sensory fibers that are taking information from the surface of the skin back to that specific spinal cord segment. So, for example, we can see here we have the cutaneous innervation. We can see here of the upper limb, we've got an anterior view of the right and a posterior view of the right. And we can see that the upper limb has a nerve supply from the C3, C4, C5, C6, C7, C8 cervical spinal cord segments. So these segments of the spinal cord are going to receive sensory innervation coming from these respective parts of the body. So if someone was to hold your thumb, that information would pass to the 6th cervical spinal cord segment. If they were to touch your shoulder, it would go to either C5 or C4, depending on which bit they touched. So we have a map. We have a map on our upper limb which tells the spinal cord where that sensation is coming from. See, we've got C3 all the way down to T3 here in the axilla. And here we can see C3 and C4 is the base of the neck and the superior aspect of the shoulder. Here we can see we've got C5, which is the lateral part of the arm. We can see we've got C6, which is the lateral forearm and the thumb. We can see this on both the anterior aspect and we can see it on the posterior aspect as well. If we look to C7, we can see that is the middle 3 fingers, so digits 2, 3, part of 4. And also we can pick it up, follow it back all the way along this posterior aspect of the upper limb as well. We can then see C8, little finger, and medial forearm. We can see it running up here. T1, we can see its location, T2 and T3. Now this may seem some random arrangement. It may appear confusing, but actually if you see, it actually follows quite a logical pattern if you hold the arm in this orientation. C3, 4, 5, 6, 7, C8, and then we know we move on to the thoracic spinal cord segments. So T1, T2, T3, and then running down the chest would be 4, 5, 6, 7, 8, etc. And this is all due to a developmental process. And if we look at the development of the upper limb, I'm not going to go into this in much detail, but we can see the developing embryo on this side of the slide. We can see the developing embryo, the pictures at various stages. And what we can see is that we have here, quite superiorly, on the lateral surface of the developing embryo, we have a limb bud. And this limb bud is going to be your upper limb. We can see here we've got the prominent spinal cord which is forming. And if we compare that to this diagram, we can see that the spinal cord segments have already passed out to their respective dermatome. But yet we've just got this limb bud here. We haven't actually got an arm yet. We haven't got a forearm. We haven't got a hand. We've just got this little bud. But we can see that we've got the C5, C6, C7, C8 arrangement already in place. And all that's going to happen is that the arm is going to develop, the forearm is then going to develop, and then the hand is going to develop. And as these structures develop, so they take with it their spinal cord segments innervation. So we can see that as the limb bud develops from these lateral protrusions, we have a very predictable arrangement of the dermatomes. We can see that the thumb, positioned cranially here, pointing up towards the head region, this is forming the lateral surface, and then the upper limb's medial surface down here is more caudal. So we have a cranial aspect of our upper limb, we have a caudal aspect of our upper limb. We have a superior aspect, we have an inferior aspect. And as the dermatomal distribution is already laid out here, we can see that it's just going to follow that path. So it's not just a random arrangement, it is actually predictable due to this developmental process. So we can see C3, C4, C5, C6, C7, we'd have C8 here, and then T1 and T2. And obviously we can relate that to the diagram we saw previously. So we've looked at areas of the upper limb that receive innervation from the spinal cord segments, the dermatomes. But what actual nerves supply the dermatomes? Because these are named. The dermatomes are supplied by cutaneous nerves, and these are mostly derived from the brachial plexus. The brachial plexus will cover in great detail in the next lecture. Is coming from segments C5, C6, C7, C8, and T1. Segments, or spinal cord segments, give rise to a whole series of nerves that form the brachial plexus. And we have a whole series of named branches. And what you can see is that here we've got a very similar map to the dermatomal distribution from the previous slides. Here we've got a right upper limb anterior view, we've got a right upper limb posterior view. And you can see that the various nerves that supply the dermatomes are named, and these can be quite confusing. So we can see we have up in this region some supraclavicular nerves. These supply this region, which is the region above the clavicle, so supraclavicular. We have the radial nerve here. We have the musculocutaneous nerve. We have the median nerve, the ulnar nerve, all supplying their respective parts of the upper limb, both on this anterior surface and musculocutaneous nerve, radial, ulnar, supplying on the posterior surface. So these are the actual nerves that supply the dermatomes, that give the dermatomes their sensory distribution. We can see, got more details coming down on the screen on this side. Posterior cutaneous nerve of the arm, a branch from the radial. The lateral cutaneous nerve of the forearm. Medial cutaneous nerve of the forearm. Posterior cutaneous nerve of the forearm. So all of the aspect of the forearm is covered via these cutaneous nerves that are coming from specific places. Coming from the musculocutaneous nerve. Coming from the brachial plexus directly. Coming from the radial nerve here, or the radial nerve, or the intercostal nerves. So I don't think it's important that I go through these in painstaking detail. It's just an important reference to see that the dermatomes that cover the body are receiving their sensory information via these specific cutaneous nerves. And we'll see these in more detail when we look at the brachial plexus and see where they come from. So in conclusion, we've looked at the main superficial structures. We've looked at the superficial and deep fascia of the upper limb, specifically the brachial fascia. We've then looked at venous drainage, which is originating from the dorsal venous network. And laterally, the cephalic vein, medially, the basilic vein, and how they converge at the elbow to form the median cubital vein. We also see how they converge superiorly to form the auxiliary vein. And then finally we looked at cutaneous innervation, the dermatomal distribution, which is determined by those developmental processes, and the actual specific cutaneous nerves from the various spinal cord segments.